Good afternoon and welcome to CentraCare Health Facebook Live chat about influenza. We're going to be answering some questions today about the flu, and you can feel free to ask questions in the comments and we'll share them. Joining us today is Dr. Joel Dunn. He is a family medicine physician at CentraCare Health Sauk Center. And Dr. Dunn, thank you for joining us and answering these questions today. First, it seems like Minnesota is getting hit a little bit earlier this year with influenza. Is that true, and why?
Actually, good question. It's about the same as it usually is for when influenza hits. However, it has been a more difficult flu season, a little bit more severe than we've seen in the last couple of years.
Okay, so you would say, is this year worse than others for influenza?
You actually have to go back to 2014 until you would find an influenza year that's been as difficult as this one so far here in Minnesota.
Okay, and why do you think it's been kind of hitting us a little harder this year?
You know, there's a couple of reasons for that, but the main one is that the particular strain of influenza that seems to be active in our area is not very well covered by the current influenza vaccination.
Okay, so with that, hearing that maybe the shot isn't doing the best to cover us, is it too late for someone to go and get a flu vaccine?
Great question. It's never too late to get the flu shot, and I would strongly recommend, if you haven't gotten the flu shot yet this year, to go ahead and do that, because it's still one of the best things that you can do to prevent getting influenza.
Now, there's some people that maybe feel some symptoms and think maybe it is the flu, but it could actually be the cold. So what's the difference between a cold and actually having influenza?
Initially, it can sometimes be challenging to know, is this just a common cold or actual influenza? They both start out with similar symptoms. You get chills, you may get a cough, you may get a stuffy nose, a scratchy throat. But with the cold, the symptoms tend to end there. They're pretty mild. With influenza, next thing you know, you'll get whole body aches, you'll get high fevers, you'll get a cough that makes it feel like it's difficult to breathe. It's typically much more severe symptoms.
So when should someone be seen by a healthcare provider, be seen by a physician?
That's a really good question, because the initial instinct is to rush off to the doctor or urgent care or the emergency department when you start feeling these influenza symptoms. For uncomplicated influenza, those symptoms I just mentioned, the best thing to do is actually stay home. Don't go into clinic where you may spread things to others. You want to stay home and do symptomatic cares, and your body should be able to fight this off. However, if you have signs of complications of influenza, that would be a reason to come on into the doctor, urgent care, or potentially even the emergency department.
What are some of those flu complications?
Good question. The influenza virus can have complications. The main one is pneumonia. So getting a superimposed or a bacterial infection in the lungs on top of that. Dehydration is a big one we worry about, particularly in the elderly and small young children. We worry about severe complications. They're pretty rare but can happen. Things like severe muscle breakdown and muscle weakness, disorders that cause people to not be able to walk, that can affect the heart long term. So a lot of potential serious complications from influenza.
Okay. So how do you know if you actually have the flu? Is there a test that you can take similar to like a strep test?
Most of the time, your doctor is going to be able to diagnose influenza clinically based on your constellation of symptoms, how you look, how you feel. But there is actually a test for it. It's not the most comfortable test. It's kind of a Q-tip swab that goes in the nose, and usually within about 10 minutes they're able to give you an answer. The influenza swab tests for two main types of influenza, influenza A and influenza B.
Okay. So you've had the test, you have the flu. What should you do?
First thing, stay home. Don't spread it to anybody else. That's the big thing for influenza. There are a lot of things you can do to treat the symptoms. So the cough, the congestion, the high fevers, you want to take Tylenol or ibuprofen for those symptoms, the muscle aches, if those are safe medications for you. Stay hydrated. Make sure you're drinking plenty of fluids. If you can't keep down milk or things like that, switch over to Pedialyte or Gatorade. Water is always a really good option.
All right. So you have the flu, you say stay home. How is the flu transmitted? How could you get the flu?
That's a really interesting question. The reason the flu spreads so rapidly, and currently influenza is considered widespread, not only in Minnesota, but across the entire United States. And you're contagious for 1 to 2 days before you have any symptoms. So by the time you start feeling crummy, it's too late. You've already been passing it to everybody you know.
Okay. So how is it that we can best protect ourselves from getting the flu?
Number one, get the flu shot. The risks versus benefits of the flu shot, in my opinion, the benefits vastly outweigh the potential risks of the flu shot. So number one, get the flu shot. Number two is you want to have good hand washing technique. Flu is spread by respiratory secretions, so coughing, sneezing, touching things with dirty hands. So you want to make sure that if you're coughing, you cover up with your arm, not with your hands. And hand washing, hand washing, hand washing. That's the best thing we can do to help prevent this. And the other one is, if you're sick, stay home. Don't spread it to anybody else.
Right. Well, so it's some of those hygiene things are hard to have children do consistently. So how can you protect your children from getting the flu?
Number one is get the flu shot yourself. So there are groups of populations of people that are at high risk for those complications I mentioned earlier. The groups are children under the age of 5, but particularly under 6 months old. Anybody who's 65 or older, strictly based on their age, because our immune systems tend to get a little bit weaker as we get older. Anybody who has chronic lung disease, COPD, active smokers, asthma, they're going to be at high risk of complications. People with diabetes are at high risk of complications. Anybody with a weakened immune system due to active chemotherapy for being on cancer or taking chronic steroids for any medical conditions they may have, all of those people are at high risk of getting influenza. So getting your flu shot will help protect those you love around you that are in those high-risk groups.
Speaking about the flu shot, how is it that how do they decide what actually goes into the flu shot to help protect us?
Good question. So the influenza shot this year, it's called a quadrivalent shot. That means there's actually 4 different strains of influenza. I mentioned before there's influenza A and influenza B. They're all the same family, but they're like different family members, so different children in the same family. They're related, but they're all a little bit different. So in this year's flu shot, there's 2 strains of influenza A and 2 strains of influenza B. The way they determine that is they actually look on the other side of the globe at the southern hemisphere and try and figure out what strains of influenza are circulating the season before flu season here in the northern hemisphere in the United States. And so we do our vaccination design around what strains they anticipate are going to be out.
And what strains have been prevalent this flu season so far, and is the shot helping to protect from that?
Great question. The most common flu that we're seeing is influenza A, and it's a specific strain called H3N2. They come up with great names for these vaccinations and influenza strains, but it's influenza A, and the last I read is about 30% effective, maybe a little more, up to 35% effective for that particular strain, so not the best this year. That's the bad news, but the good news is if you've had the flu shot and you still get influenza, your symptoms are going to be less severe, you're going to have a lower likelihood of these complications of influenza, and your symptoms will last a shorter time. So even if you get the flu, if you've had the flu shot, you're going to be better off.
Okay. Now, a little bit of history on the flu. This same strain that we see now was actually prevalent back in the early 1900s. Is that correct?
Yeah, influenza has been around a very long time, and similar strains that we're dealing with now were here 100 years ago. This is the 100th anniversary of something called the Spanish flu, or as an influenza pandemic back in 1917 and 1918, right around the time of World War I. And this was the influenza A, H1N1 was the exact strain. That's actually a strain that's in our flu vaccinations this year. And it killed 50 to 100 million people worldwide. So if you do the math on that, it's amazing how many people that is.
Now, what is obviously a lot has changed in 100 years. How is it now, 100 years later, that we're not going to hopefully ever see something like that happen again?
I think it comes down to a lot of different things that have added up to make a big difference for our public health. We've got better sanitation. We've got a better understanding of how these viruses are spread. We've got a vaccination that can help make the symptoms less severe if you get it and ultimately protect you completely from getting the influenza.
Okay. Well, if anyone has any questions out there, feel free to ask in the comments. If not, we'll just kind of wrap up with going over again a little bit of some of those symptoms that you need to watch out for if you think it might be influenza.
Yeah, so to differentiate the common cold from influenza, stuffy nose, scratchy throat, little bit of cough, pretty typical cold symptoms. You can treat those symptomatically, you'll do great. Influenza symptoms, high spiking fevers, muscle aches where your whole body is aching and sore, non-productive cough. Those are the main symptoms that you'll get with influenza.
Okay, and again, the best protection from getting the flu is?
Number one, get the flu shot. Strongly recommend that.
And it's not too late.
Definitely not too late. There's a good supply of vaccination at your local pharmacy, at your local clinic. Definitely go out and get it.
Great. Well, Dr. Dunn, thank you so much for taking time to answer questions about influenza, and thank you everybody out there for joining us. We'll hopefully have some more of these Facebook Live chats coming up. But again, thank you and have a great day.